Welcome to the first hearing of the year for the Subcommittee on Communications Technology, Innovation, and the Internet. I'm joined this morning by my colleague and ranking member, Brian Schatz. There is a lot of interest among senators and members of the committee in this topic. They'll be coming in and out and participating in the hearing, and I expect to have a lot of questions and discussion as we proceed. Advancing telehealth through connectivity is a timely topic for the committee this year as we look at ways to modernize our communication laws. I hope today's discussion will serve as an educational forum on the progress we've made, as well as an opportunity to identify ways we can ensure all Americans have access to the great advancements in patient care and delivery. In fact, this year, Senator Cochran and I plan to introduce the Telehealth Advancement Act, which is aimed at improving Medicare reimbursement and working toward payment parity. Many barriers to telehealth exist outside the realm of communications. However, without broadband, telehealth is not possible. Ensuring all Americans, particularly those living in rural and remote areas, have access to high-speed broadband has long been a priority of mine. In Mississippi, for example, AT&T provides broadband service to the University of Mississippi Medical Center. The hospital's telehealth solutions include the deployment of portable medical carts to rural hospitals and clinics, allowing patients and doctors in remote locations to interact in real time with medical center specialists through video and the transmission of diagnostic information. Also, the Diabetes Telehealth Network pilot in Sunflower County, a first of its kind nationally, is intended to forge a stronger connection between clinicians and people with diabetes. It supports earlier clinical intervention, more effective use of health services, and positive health habits and behavior changes. In this instance, C-Spire provides the high-speed and mobile broadband communications network needed to support this connection between patients and clinicians in even the most remote parts of Mississippi. The state of Mississippi has made great strides in telehealth and in closing the digital divide, but there's still work to be done. 54% of our citizens live in rural areas, and we have the lowest ratio of physicians to patients. Nationwide, more than 53% of Americans living in rural areas lack access to what the FCC now classifies as broadband service. 53% of Americans in rural areas lack this access. Only 8% of Americans living in urban areas lack this technology. I would like to welcome all of our witnesses and thank them for testifying this morning. Our panel today represents a wide range of public and private stakeholders working to identify barriers to improve access to telehealth throughout the country. It's a special privilege for me to introduce Dr. Christy Henderson from the University of Mississippi Medical Center. Dr. Henderson was kind enough to educate me to the extent that that could be done on all the wonderful things going on at UMMC to connect patients throughout this state with doctors and healthcare professionals remotely. And I'm pleased to welcome her and other distinguished members of our panel, Mr. Jonathan D. Linkus, Chief Executive Officer of American Telemedicine Association, Dr. M. Chris Gibbons, Distinguished Scholar in Residence, Connect to Health FCC Task Force, Federal Communications Commission, and Mr. Todd Ridding, Chief Technology Officer, Panasonic Corporation of North America. So I look forward to the testimony from this distinguished panel and to the opening remarks by my distinguished ranking member, Mr. Schatz.